Oregon recently became the first state in the nation to decriminalize drug possession. In 2020, voters overwhelmingly supported ballot measure 110, which removed harsh criminal penalties for possession of small amounts of drugs and earmarked $230 million to help people survive addiction. So, how is it going? We've brought together a group of experts on the front lines here in Oregon for an open conversation about drug laws and addiction treatment, all on the backdrop of this historic policy change. I'm Stephanie Strong, the CEO of Boulder, a telehealth provider of treatment and long-term support for people with substance use disorders, based here in Portland. I'm joined by my colleagues, Dr. Andy Mendenhall, an addiction medicine physician, president of Boulder Medical Group, and leader of Portland's largest nonprofit agency for people impacted by homelessness, poverty, and addiction. Jade Waits, a peer recovery specialist who identifies as a person in long-term recovery. She lives in Portland and serves patients through Boulder Care. Rose Bromka, Chief Operating Officer and a fourth-generation Oregonian, who spent over a decade in philanthropic leadership focused on poverty alleviation in New York City. And Justine Pope, a master's in public health, researcher and harm reductionist focused on community engagement across the state of Oregon. Andy, as a physician treating some of the highest need patients with addiction and severe mental illness, what have you observed in the years since Measure 110 passed, and what factors are contributing to the many challenges we're facing here in Portland?
Thank you, Stephanie. First, we're taking a law that, with good intention, but it passed in a state that actually historically has some of the lowest per capita access to substance use disorder treatment in the country, and has tragically held that position for many years out of the last 2 decades. As a person who actively engages in patient care for folks with substance use disorder, we've seen the drug supply profoundly change between the summertime of 2021 and today. And it was really the fall of 21 when we started to see synthetic opioids, in particular fentanyl, really flooding the market and replacing much of the historical opioid supply, which was traditionally black tar heroin. That combined with much less expensive and ever more potent methamphetamine have really, I think, contributed to straining a system of care that was poorly functioning on a good day prior, and globally had delays and lack of access to services, especially for folks served by Medicaid-based services.
Mm-hmm. So the state of Portland and Oregon today reflect much more than just decriminalization as a policy. It reflects a fentanyl crisis, a housing crisis, the global pandemic. So all of these factors citing, it's reason to refute the notion that we can call Measure 110 a failure without pointing to the backdrop on which it was implemented. And implementation, I think, is an piece as well as we think about learnings that other states can draw from Oregon. Rose, maybe I could ask you about your work as a recipient, really orchestrating the collection of grant funding with some support from the state to try to fill this growing treatment gap that Andy described.
The intention of Measure 110 was spot on. The way that you impact change and de-risk experiments for government is to give dollars to those who are doing the work on the day to day, and to give those dollars without strings attached. And the Measure 110 experiment struggled to deploy those dollars for years. So while the national news points to a 3-year history, the actual deployment of those funds was much later. So what we found in the first 12 months was that some of the pivotal pieces went unfunded without having resources. Getting organizations who have not collaborated to do that work is incredibly difficult. Once you break through that red tape, you find that there are many more alliances and alignment in doing what needs to be done than perhaps is perceived at the outset. And we've certainly found that at Boulder. After overcoming some of the notions about the work that we were doing, there's so much opportunity to collaborate, and actual desire. We'll never be a housing provider, but we need housing providers because sometimes the biggest barrier to medication treatment is the housing. And that will be something that we can't individually overcome, but we can overcome in collaboration.
Absolutely. To first decriminalize drug use, but only recently, years later, to start the flow of funding to the organizations that are meant to provide addiction treatment and services means we've barely had a chance to start the work. And the bureaucratic process, the amount of time it takes to collaborate and get organizations together and start filling capacity takes time. Any positive change is something to celebrate. Better for the individual, keeping them safe, better for society. A few things about Measure 110 in the decrease in arrests and prosecution for Black men specifically, which, as we know, so much of drug policing and prosecution happens across racial lines, is a major win. One of the reasons there was such strong support for Measure 110 and unwinding some of the justice system that has just not been serving citizens for many, many years. Jade, would love to hear some of your thoughts specifically on justice system reform, but broadly as someone who works in this field, having been through many of these challenges yourself.
When houselessness seemed to kind of take the forefront and go hand in hand with substance use disorder, it's hard to see folks that are struggling in addiction and face the humanity of that. I think it makes it difficult to see something that could actually be successful. And which is oftentimes why, the crossover between criminalization and houselessness exists, because if someone is arrested and incarcerated on a substance charge, you're not going to have to see them anymore. You're going to pay for them to be incarcerated. It's like if they entered a shelter, but the alternative is less punitive and, with an integrative approach could actually help them save themselves. I think that now when we think about someone, the potential of them being arrested on a drug charge, we see things differently as opposed to maybe through like a subconscious bias lens, right? Which could be rooted in a lot of that racism that Oregon has historically kind of upheld.
Drug use is happening. It's happening on the streets because people aren't housed. It would happen in housing. It would happen in jail. And people who are seeking help or would seek help face barriers in finding housing and in finding drug treatment. So we've talked about the restrictions that make it really difficult for families, mental health demands, a host of factors that make it really challenging for people to seek addiction treatment in a one-size-fits-all model, or to find an open bed that accepts Medicaid, low-income folks who are really struggling to find help. Justine, I know you also have a lot of direct experience in the community all over the state and working with folks who are in various stages of using drugs, seeking treatment. How do you react to some of the comments our colleagues have made?
I really appreciate having this conversation, and especially given how much negative press has been focused on Portland specifically, but around the state. I'm a public health person, but a harm reductionist first, and so I want to take a step back, and I'm happy to speak critically. I think that's really important to do, but our state voted an approach that said, we don't believe in criminalizing possession of drugs, as simple as that. And we would rather fund care than fund jails. We would rather route people towards supports wherever they are in their use than routing people towards the carceral state. That literally put hundreds of millions of dollars into communities around the state and people who really needed it. And you, Rose, spoke to the fact that it took a while for the money to get out there, and including decision making and having at the table people with lived and living experience and just the creaky gears of having change happen with an equity perspective. The access of money by harm reductionists, I've seen it transform organizations I volunteer with in really essential ways, from being able to rent a warehouse space so we can centralize storage and distribution versus keeping it on all our back porches and in this one groovy church that would lend us one room where we could keep things, having drop-in places for people to come for peer support or services, folks who are already doing this work in community. I might be sounding optimistic now because there's still critiques of it too that are very valid, but I want to ground myself in that.
I so appreciate how Justine framed citizens of Oregon voting overwhelmingly for Measure 110 because it was a value statement that didn't just say, like, we value care over prison, we value people. And people who are actively using substances are still valuable people. And that is a radical notion that the entire country and world would benefit. And it is alarming that there are still such foundational stigmas throughout our systems where it is acceptable to essentially say that someone isn't valuable if they're actively using. And I think one of the most hopeful aspects of the work that we're all engaged in is the notion that whoever you are important and you're worth supporting in whatever way you want to be supported today. That could be safe use supplies. And that's great. We want you to be here and we want you to be alive. That could be a peer specialist who will walk alongside you. Could be access to medication treatment or housing or all of the above. And it usually takes some combination over some period of time.
I'll build on that, Rose. I really appreciate your commentary. And Justine, thank you for anchoring us in that set of values. First, I mean, unequivocally, we see the impact that substance use disorder services have on helping people transform their lives, get into recovery, take that positive trajectory. And it's also important to recognize, and Jade, I think you said it so articulately, that the visibility of active substance use is something that I'm going to paraphrase, but I don't think the general population was prepared, right, to see the confluence of literally an affordable housing crisis, a new drug supply, and a roll up on a historically non-functional, inadequate system of behavioral health care. You know, in particular, the supply side doesn't seem to be getting any better, unfortunately. And so at the end of the day, we're really starting to see the re-stigmatization, the dehumanization, the othering of folks that we are committed to serving. And this is going to be front and center of a lot of local discourse over the next year or two in the election cycle as well. And my hope is that we'll be able to preserve the benefits at a time when we're waiting for the needed tens of thousands of affordable housing to come online, many hundreds of residential treatment beds, and dozens, if not 100 or so more inpatient withdrawal management beds to come online and make a meaningful and tangible addition to a community and the communities around Oregon that have lacked that access for more than 2 decades.
Criminalization of possession also runs the risk of reincarceration, mostly because of lack of access to resources after the fact. So if someone is incarcerated because of drug possession and upon their release has a felony, that's also going to become an impact in finding secure housing, even if they're already remaining abstinent from using substances. So when someone is in fear of that system, it's really difficult to access any type of resource that you might perceive to be working within that same set of systems. So let's say, for example, if someone's referred to a treatment program by a police officer, it might be difficult to trust that program if you have trauma with that police agency.
There's something, and Jade, I appreciate you just said it this way. People often talk about Measure 110, and you described it correctly, which is it decriminalizes possession of drugs. It decriminalizes possession of small amounts of drugs. And in part of the myth making, it's saying drugs are legal in Oregon now. And so that already is a talking point that has gotten out, I think is pretty potent. And it's one that I think is really important in our own language to be really clear around. You cannot be arrested for just holding on to small amounts of personal use drugs. And there's varying weights depending on the drug class. So that's where it gets a little bit sticky. So I try to stay high level so I don't even get confused by saying decriminalize possession of small amounts of all drugs.
I think maybe the perception, you nailed it. There's a myth making of what's happening in Portland from the outside as if we've legalized drugs
Yes.
or
Yeah.
encouraging drug use, when these activities are still being policed and prosecuted, but Measure 110 has implemented a $100 fine, which is meaningful for a lot of people, which can be waived if they choose treatment.
I strongly believe and have seen the data that there was a ton of disparity and inequity that dates all the way back to the early phase of the drug war, right? Just the difference in sentencing for crack cocaine versus powder cocaine was part of institutional racism in the prison industrial complex, right? And to your earlier point, Justine, Measure 110 was a new approach. Where does that take us to today? Well, how do we help? Proactive restorative justice models that maybe haven't even been constructed yet, but again, in a fully resourced continuum of care, which we do not yet have in the state of Oregon. We're actually far from it.
The national discussion about incarceration, it does often seem like I'm left dissatisfied. Just, well, put them in jail and they'll detox, they'll be off the street, they'll be safe. We recognize these are still our neighbors and citizens. They will be incarcerated one day and back in our community the next, and we all have a stake in trying to keep them well. And we are also funding jails just as we're funding treatment programs. So the economic art is one, again, of just where we put our tax dollars to ensure that we're doing the best thing for our society. We endanger people's lives and increase overdose by incarcerating folks without a plan.
Well, I think we have to recognize that our carceral system also needs to be addressed. It should be that not only are you guaranteed access to medical care while incarcerated, but you're guaranteed access to the gold standard of treatment for substance use disorder. And that is far too few and far between in the vast majority of the settings. We've recently celebrated the federal change to make those funds available, and yet we've also, as is our human nature, made that a very bureaucratic process by which states will either invest the resources required to make medication treatment available in our carceral systems or not. Again, like spreading the disparity. We also know that we have historically turned off access to public benefits like Medicaid, thereby ensuring that they have no way to maintain any recovery they may have found inside.
You know, we work with patients who have drug use in their home and kids who've grown up in this environment. And then once you start getting stuck in this web of the carceral system or the foster care system, the weight that you described, Justine. Now I've got a criminal record. Now I struggle to get housing or keep a job or a driver's license. And these things compound on top of each other. So it is impossible to talk about addiction without talking about the broader social safety net.
You know, not to be a downer, but and I want to bring the hope and like witnessing and participating in real change that's happening. And I want to point out that I actually, as an activist, organizer, I'm pretty depleted by the fact that there's been a contraction in response to the passage of bills like 110. And so I actually think that was a step forward. But just looking at Portland City and County work, it has been outlawing day camping, requiring any volunteer providers to have parks permits to provide services outside, cutting county harm reduction funding, preventing county harm reduction providers from just evidence-based practice. And so for me, it's felt really fatiguing and defeating that those of us who are trying to be on the right side of history are pushing back up against the contraction. And so I just want to bring that to the table because I'm not sure what the future is going to be, partially because they're not seeing the impact as quickly as they hoped.
Yeah, well, I definitely think that if we're looking at some holistic, wellness standpoint, then we should look at decriminalizing the other, the other things that can be affiliated with someone that's in active use, right? So rather than just decriminalizing possession, then, creating camping ordinances and things that are, punitive or that can fine others, just definitely an added barrier. I've seen that a lot in Southern Oregon, with, smaller counties and just, limiting access to resources, whether that just be land to sleep on or bathrooms to use. The access for harm reduction in someone's own personal use becomes diminished. So even someone who happens to use drugs intravenously and that needs access to clean water, if they're, banned from an establishment that is the only one that has a restroom, the harm becomes greater when the water that they may use comes from a pond, right? Or from an older water bottle.
There are parts around Portland where it's definitely less safe to be during certain times of the day or at night. And so folks that are expressing their compassion fatigue are expressing it in different ways. And I think we're going to see a lot of political activism that happens as a root of that. And all of that, again, is happening in a framework of a perfect storm, of not enough shelter, a timeline of a couple years to get there, a flood of new and reinforcing drugs that are creating levels of impairment that as a clinician has been doing this work for 16 or 17 years, is going to require, right, levels of care that don't yet exist. And unfortunately, for as much as we all concept of harm reduction, oftentimes harm reduction interventions are all folks are able to offer because the wait times are so long to get into outpatient or because it takes 2 or 3 times to go to a medical detoxification center, and just keeping that person going back to that medical detox center and maintaining that connectivity, right? We're at a time where we simply must acknowledge compassion fatigue. We can't question it. We can't shame people for being tired, that they can't walk their kids or their dog at the park and actually feel the way that they used to. We're going to have advanced solutions like telehealth, like high empathy, high touch, high compassion connectivity, and also a willingness for those of us working in the service sector, providing substance use disorder services, to continue to educate folks and acknowledge, right, the compassion fatigue and frustration that exists within segments of our economy, right, and members of society that continue to ask how much further is this going to remain the way that it is before we start to see the change. And I think that change is on the horizon.
That was what was frustrating about the coverage, is that while acknowledging the compassion fatigue, the blame was not placed at those with political power and will. It was placed at the feet of the individuals who were in active chaotic use on the streets of Portland. And that is, quite frankly, bad journalism. I hope that business owners in downtown Portland are angry enough to become political activists, because when you talk about a broken social contract, that is real. You can look at states where a right to housing is embedded in the funding stream. And that's been something that the state of Oregon and the city of Portland haven't been willing to contemplate. And that is what moves the needle, not the individual person who's actively using on the streets of Portland. And I hope that both the conversation within our state and the conversation nationally looking at the experiment here puts the responsibility and accountability in the right places, which are the folks that hold political power and will and purse strings to do the right thing.
Because people didn't vote to just get people out of jail and abandon them. We voted to give them support and resources. And that is an area right now where I think we're all kind of in the void. And what an excellent point that we are once again placing blame on people who are using drugs instead of thinking about the people we funded and tasked with executing this policy in a way that would support treatment providers like all of us, like all the people doing the work on the ground who have been really eager to be asked, what do you need in order to get people who are resistant to getting care or who aren't getting care today into a better place? We actually have a lot of answers. And when we talk about people who are resistant to using services, or we question, what do we do about the people in Portland or in Oregon who just don't want care? Let's look at what that care looks like. If to get that medication, you have to stand in line at 5 a.m. in a methadone clinic, you can't go for your sister's wedding, you can't slip up or miss a single day, or they may kick you out of that program and back into desperation and withdrawal. It really doesn't create many options for people. The urgency of the overdose crisis has always been fuel to our fire, but we now have the urgency of having to do this before we revert to outdated policies, which takes away often from treatment providers, social services organizations, and puts it, as Andy mentioned, into trying to police the supply as the demand gets higher and higher and people find new ways and more dangerous drugs. So that's a major concern I think we have, is ripping the rug out from under the providers who are just starting to do work with the funds that Measure 110 has afforded us. And seeing great success on a small scale, but knowing we need to really ramp it up much faster at the speed and scale necessary to really make a dent in this crisis.
I will offer that I'm more hopeful, having been in Portland for 31 out of the last 33 years. There we go. I see greater alignment at city, county, state, and even federal levels than ever before. And I see folks willing to have brave conversations like our conversation today, with the purpose of elevating services to the members of our society who are struggling with substance use disorder. They're members of society, and they're valued members of society. Substance use disorder impacts 1 in 4 American families right now and today. It's not going anywhere. It's not a moral failure, right? This is a biological disease state. It's learned behavior. It's conditioned behavior. It's a trauma response. It's all the things. Most importantly, it's true. People recover, right? And I'm really optimistic that restoration of the social contract, especially for folks being served by the Medicaid benefit, right, that we're all collectively paying for, will become more balanced, will become more transparent, and will be scaled in this region in a meaningful way. Clearly, telehealth services are leading the way to provide a different type of engagement, a different type of interaction with patients. It's super exciting to see all of the favorable, not surprising, but just exciting to see all the favorable results for ongoing clinical engagement, ease of access to close some of these critical structural gaps that are part of resolving that broken social contract that has existed for generations as we think about the treatment of substance use disorder.
I'm grateful for this conversation, and to each of you for sharing your perspectives as citizens and caregivers. It's clear we're up against immensely difficult challenges, but in the daily course of our work as services providers, we see the transformational impact made when a person with addiction is given the opportunity to get well. So we must continue to problem solve, learn from history, and hold elected officials accountable for expanding treatment services in our communities. Thank you all for listening today. Please note that the views expressed in our session represent those of us as individuals and not our affiliated organizations. Take care and be well.